Well, this week on East Coast Breakfast, we launched the Big Favour from Pain to Possibility, where we'll be giving someone a new life with the help of Busamed. Entries are now closed.
And while the team, the capable team at Busamed review the entries, we want to get to know the heroes behind the scalpel. By the way, trademarked by Comedy. That was her phrase.
Love
That's
it,
yours.
yes.
I dig it. Joining us right now is a neurosurgeon. Guys, when you get a neurosurgeon to pause their life and actually come and spend time with you, you must know you've made it.
And I always have so many medical questions. So
you do. So let's get into it.
In between.
All right. Dr. Victor Stollenberg, good morning.
Morning to you guys.
Thank you for joining us, Mr. Neurosurgeon.
It's a pleasure.
So, Carmen asked this question. What's the most complex surgery you've ever performed?
I think before I answer that question, I want to just tell the listeners, and good morning to the listeners, that most of them will encounter neurosurgeons with the general problems like back pain, neck pain, and then in difficult cases, maybe brain tumors.
Yeah.
But in certain cases where we talk about complex brain surgery, there's specific areas in the brain that are complex, and that's usually those skull-based tumors, abnormal blood vessels, spinal deformities, as well as interspinal dural tumors that we call.
Yeah, those ones can be tricky. I know because we had a consultation with just across the road here, another neurosurgeon.
If you ask me about complex case, what did I operate?
Yeah.
The most complex ones is what we call the foramen magnum tumors. But what foramen magnum tumors is, and where the foramen magnum is the hole at the base of your skull.
Yeah.
This is where your brainstem goes over to your spinal cord. And this is where all the blood vessels runs, most of your lower cranial nerves. And this is a very delicate area, like most of the brain. Yeah, I had one patient that I operated 5-6 months ago. And unfortunately, this is complicated cases. And planning, preparation is so important for these patients.
Yeah.
You might be a skilled surgeon, but you must also have experience in this type of tumors. Luckily for us, the patient did well. After 10 hours of surgery, the patient did well.
So
10 hours.
That's insane. But I want to know, so this is South Africa, and we see a lot of things on TV, and you see a lot of people either being shot in the head or stabbed in the head, or something happens to your brain and your head, and somehow miraculously doctors manage to save these people. What is the most unusual case you've ever been involved in? Have you ever had to remove, say for instance, like a knife from somebody's skull?
Yeah, I mean, I think most of us as registrars, when we train as neurosurgery, most of our work is trauma related here in South Africa.
Yeah.
Unfortunately, this is our statistics. But yes, definitely patient that was stabbed in the head, patients who had gunshot wounds, and patients specifically stabbed in the eye where this blade goes all the way down into the brain.
Ugh.
And then you need to go and remove that safely.
Hey, so at which point in your life do you realize, hang on a second, this stuff that I'm going to be doing, you either have a constitution or you can handle it or you can't. It's just like early in med school you go, I can do this or I can't.
I think it's something that most of us always wanted to do, is help people.
Yeah.
So helping people, you look past that. You don't ask questions why or what.
Yeah.
The problem is in front of you, and you need to treat and handle it to the best of your abilities.
What is the longest time you've been doing surgery for? Like you said, 10 hours, but I know you guys sometimes do 20 hours. It can go.
Yeah, so the longest was about 16 hours.
Sure.
And do you
2 full days of work.
Do you ever use, because it's a world of it now, like AI now, everyone's using it. During those 16 hours, I need to Google something. ChatGPT.
No, because 16 hours, let me quickly do a test.
I think
a multiple choice.
You might be a danger to the patient. I think it's a relevant question. But, for us, especially with complicated and complex cases, is days before preparation. We read, we go through. And then what makes our surgery not always easier but safer is definitely that we've got technology. I mean, we can build how the tumor look, what is around the tumor. Intraoperatively, we can We got city guidance navigation systems that can take us where blood vessels sit and where we should not go. So that definitely the technology we use and make a difference in patients' outcome.
We're hearing that the more and more doctors we talk to about how, especially in the last 5 years, there have been leaps in the science that have made what you can do as doctors, especially neurosurgeons, even more exceptional. We have with us neurosurgeon Dr. Victor Stollenberg. He's with us this morning. It's all part of the Big Favour, From Pain to Possibility, where we'll be giving somebody a new life with the help of Busamed and one of these surgeons. But he's in the room, so we can ask the questions.
Yeah, I have a question about brain health.
Okay. I also have a question about misconceptions, and there's also a TV show that I watched, and I have a question. I need to know, right? We've got the neurosurgeon in the room. We need to know.
East Coast Breakfast with Darren, Sky and Carmen.
9 minutes away from 8 o'clock Friday, the 10th of July here on East Coast Radio. Is there a doctor in the house?
This Mandela Day, East Coast Radio, together with Busamed, is giving someone a life-changing surgery. One story, one act of care, one life changed.
Amazing stuff that's happening, and we're meeting these life-changing doctors now. We have neurosurgeon Dr. Victor Stollenberg. He's with us right now. Now, the Big Favour, From Pain to Possibility, we're giving somebody a new life with Busamed, and we're getting to know the men behind, or the men and women behind the surgeries. And so, Dr. Victor, you don't do the music as well. You don't do the little bit of drum and bass. That's on front ball. Not that, Dr. Victor.
No, that one.
So, what is the biggest misconception about neurosurgeons or surgeons? And then, when we watch The Pit and ER and
Grey's Anatomy,
how close are they?
Yeah.
Okay, so the first, the most common misconception that patients have, or people have about surgeons, and specific in my field, neurosurgery, is that we just want to operate. We technicians, but first of all, we physicians, we doctors. So most of our patients that we see in our rooms, or in the ward, or that consult us, are managed conservatively. About 30 to 40% of our patients are managed conservatively. Even in spinal lesions or in brain tumors that are benign, we will always follow our patients firstly, depending on how big and where it compressed, but we will do serial MRI scans first. And then at some stage, we will decide, listen, the patient needs surgery. And we see a lot of patients also with back problems. 60 to 70% of that patients that we see with back problems and back pain or degenerative changes of the spine are managed conservatively. So we give them pain medication, we send them to surgeons, biokinetists, chiropractitioners, get them a biokinist and a recovery program. And then once that failed, then we will operate them. So patients always come in, and the first thing that they always tell me, I don't want to have an operation. Don't even explain to me why they come and see me. I don't want an operation.
Fixed, but don't operate me. Okay, and then I want to know what is really bad. I think when people can't see an organ and they can't see what's actually on the inside, they don't take care of themselves, and people don't focus on their health. But what is bad for your brain health, and what is really good for your brain health?
Yes, I think the brain is like any organ. You need to take care of it. And I think always if you have a healthy diet, and some of us are not in that position to have that. So a healthy diet is always my first when I explain to patients. The second thing is the brain needs stimulation. So often reading.
Yes, read.
Some of us does not. We only read medical articles and not read anything else. But
it's still reading.
Still reading. Reading is good. And exercise. And with exercise, there's a lot of
exercise your body or your brain?
Your brain.
The reading part is exercising
your brain.
I'm hearing be with people that stimulate you.
Wow.
And stay away from drugs.
Yes, that's what's bad.
That's simple.
And alcohol.
And alcohol, yes.
Don't do drugs, kids, or alcohol. Because it affects your brain.
Yes.
And now, okay, so onto this journey that we're on right now. Sky has a sporting question. I don't know if he wants to do it now or later.
I'll also now, I can see that you're keeping a very close eye on the football that was playing FIFA World Cup. I have to ask the neurosurgeon this. Who's going to win the World Cup?
Ooh.
I would say France.
Yes.
I would say France, but in my head, I hope Belgium comes through.
Yeah.
Okay, that's a nice one. Hey, that's a cool story.
yeah.
Yeah.
So it's not coming home though. It's not coming
To
home.
England.
No. England, no.
Heard it from a doctor's guy.
Okay, sorry, Carmen. I apologize.
Actually, neurosurgeon in the room. Here's a good question: should we stop headering the ball?
I think the most important thing, yes. I think it depends on the speed of the ball, and I think nowadays with the new technology, that balls are light.
Yeah.
So it really doesn't really cause any long-term damage. I never saw a soccer player with long-term head injury problems. That's not them, unless they had a fall on the field itself, but not because they were heading the ball.
Unless they tried to tackle Erling Haaland, then you're gonna.
Then you're gonna
get
come
hurt.
second. Yes.
All right, so this journey of giving someone a new life with all of the complexities, do you think we will be ready to have surgery done for Mandela Day?
I think the team is working on it. They try their best. And they went through all the applications, and hopefully there might be some cases depending on the doctor's availability, and that's what is about. It might not always happen on Mandela Day specifically because patients need to be worked out, patients need to be examined, and need to go through the whole phase. And then there's some patient that might be operated at the later stage, but still part of the initiative.
Well, neurosurgeon Dr. Victor Stallenberg, he's with us this morning. It's all part of the Big Favour, the biggest of big favours we're doing now. From pain to possibility, we're giving someone a new life. All you have to do is go to our website and say, I need a procedure. And now the folks at Busamed, they are trawling through those entries. Hopefully we'll be able to find one, and we'll be able to sign you a surgeon. We can have that surgery, and you can experience a different life thanks to this Big Favour. Dr. Victor Stallenberg, thank you for joining us.
Thank you so much for having me.
East Coast Breakfast with Darren, Sky and Carmen.